For me, wellbeing is actually quite simple.
Having a sense of purpose in my life, whatever it might be.
People believing in me, and when I make mistakes, forgiving me and staying with me.
It's about being able to be okay enough with yourself to view life as an adventure.
It could mean the person's health or the lifestyle, the environment that they're in.
It's about kind of having a meaning to my life.
Helping other people and trying to see the best in people and try and be there for people.
I think it's making positive choices, investing in friendships that are good for me.
Being here in the moment and doing the best I can for me and the people that I care for, I think that's well-being.
Wellbeing has a range of important impacts. We know that, for instance, for our health, both physical and mental, if we have good well-being, we're less likely to develop physical and mental health problems. We also know that if our well-being is good, we're less likely to take health risk behaviour such as smoking, alcohol, drug use, because we're in less need of topping up low well-being with such unsustainable ways. We also know that there are a range of other impacts of well-being. For instance, we do much better at school, we do much better at work, we're less likely to take time off work. But also in older age, we're less likely to develop both physical and mental health problems. Therefore, wellbeing has a range of important impacts that contribute both to us personally, but also to our broader community and therefore our society in general.
I do feel like it's my responsibility to look after my children's well-being because I'm a parent, I brought them into the world. I work in a nursery and find that there's a lot of parents who are asking for advice on how to feed their children or discipline their children, toilet train their children. And there's a lot of parents that feel like they don't know the answers to those things, they just feel a bit bewildered by everything.
Well, life is hard, and it's hard for children as well as for adults. And part of our job here is not just to teach children things and to get them to know their English and their maths. It is to make them well-rounded individuals who are going to go forward in society, be relevant members of society, make a contribution, have good relationships, be healthy. And it's really vital here that we do all we can to foster that.
I think if kids can be taught what's good along with the parents, it can help. If we all help educate them, and also just get time to play and just to be children.
It's really important that children get rid of a lot of their excess energy. Exercise has been really shown to help behaviour. We actually try to make sure the children have exercise every day.
And I think that if you don't exercise, your muscles won't work, and if you do, I think you can be healthy and happy. We learn a lot about how to keep our bodies healthy and how to exercise properly.
We actually teach our curriculum in 6-week blocks, and we have a theme, and the very first theme this school year is health and happiness. We actually selected that as our first theme on purpose because we felt emotional, physical well-being is so important going forward in the year.
Me personally, because I work in the healthcare, I get stressed a lot. So what de-stresses me is doing physical things, because when I do something physical, my mind shuts up. So really, I go to the gym quite often.
My nephew, yesterday, when I bring him down the skate park, the next thing, sleep for a long time. He didn't wake up till about 10 this morning. So places like this is very, very good for them.
Wellbeing is about someone getting up in the morning and feeling good about themselves, going to bed at night feeling good about themselves.
I looked in the mirror one day and I didn't like what I saw. I smoked cigarettes, I didn't live a healthy lifestyle, and I decided, I can't have this. I went to the doctor and had a chat because it was making me feel a little bit low in life, and he said, he could refer me to do a fitness course.
We try and build a programme that is practical, whether that's not taking the car to walking the kids to school, through to walking the dog, or using the health suite that we have downstairs, how committing to try and improve their sort of general well-being. There's lots and lots of different avenues we can take.
They invited me into the gym, showed me some of the equipment, and then asked me what I would like to receive long-term from this. after the 12-week course.
We're looking at real lifestyle change. It's a brief intervention, those 12 weeks. We're currently looking at 40 new referrals each month on the scheme now as well. So it shows, looking at Corby as a small part of a whole country, it shows the amount of people that could utilise that. I've
now signed up for myself, so for 2 years now. You know, so this is expense from my pocket. To me, it's a lifestyle change. In today's society, people, they're too quick to reach for, junk food. The town's full of junk food this or that. That's not healthy eating.
Coming down to the gym as much as I can. It gives me the freedom to, if I want to have maybe a cheeky kebab at the weekend, I know I can do it guilt-free.
Because I have got quite a good social life where I'm out quite a lot. That's why I basically come to the gym, to make myself feel better, more mobile, and try to keep the weight down.
I think people should be responsible for their own well-being. I think the issue is that you don't always know what keeps you well. You don't always have an idea of what gives you your well-being, if you like, until you become unwell.
As an employer, we find it really important that we have our staff that are happy, healthy and here, basically. We really want to try and encourage them to look at their health in any small way that they can. And for us, it's about trying to engage with them and find ways that we can support them and help them in their health and well-being.
At work, I'm very lucky to be able to access a health and well-being programme, and as part of that, they run a blood pressure clinic. As I'm type 2 diabetic, I do look after my own health very carefully, and was quite surprised to find out that my blood pressure was running quite high, and that prompted me immediately to go and see my healthcare professional, which I did, and then was pretty quickly put on some medication.
We're trying to encourage people to think about things around their health and their well-being, and promote opportunities for them to take things up. That would be in work, but also outside of work.
By having a healthier lifestyle and being more aware of my own well-being, it's really helped me during the day at work. I'm less tired in the afternoon, I don't snack as much, but also by the end of the day, I still feel I have plenty of energy.
We've had some great feedback from a lot of our employees. It's given them a greater sense of motivation and helping them to come into work feeling like it's an employer that really looks after them.
One thing I think about now, having been diagnosed 3 years ago with a condition that will be with me for the rest of my life, is that I wished I'd done something before that diagnosis. And if there's one message I'd like to get out to people, it's make a difference to your life now.
We all need to feel that we're needed in some way, and I think in any community, whether it's our community at work, a church community or a community group that we're part of, we need to feel that we've got a role to play, and I think it helps build self-esteem and it helps build confidence, and yeah, I think having a sense of community is so important to having a sense of well-being.
And if people stop caring about themselves and started caring about like the old dear down the road who's like struggling and lonely.
Mingle with other people, younger people, don't just mingle with the elderly. Try and get mingling with the youngsters.
To promote your own sense of well-being, it comes down to interaction, however that is going to happen, whether that's physical interaction, whether that's making sure you go out for a walk in the morning to get the paper and you're saying hello to people, whether it's joining a new group, a new interest.
I have an allotment. I enjoy going there, spending a few hours a day.
Everybody's living a lot longer nowadays, so as long as you can keep your body going and your mind going, then you're going to get the best out of life.
Don't think of getting older. Try and keep as young as you can. Be active. Don't sit in a chair, watch television and vegetate.
I think there's growing evidence of the central part of mental well-being as being how we look after ourselves, and I think if we get that right and people are more able to care for themselves, to take healthy choices in their life, then I think they will be more able, and I think evidence shows us, there's more able to look after their long-term conditions, and that will decrease demand on the health service and improve how they feel about themselves.
If we look across the life course, as I highlighted earlier, it's important that we promote the well-being, particularly of children in their early years. During school, there are a number of interventions to promote the well-being of children. During adulthood, similarly, at work, we can promote the well-being of employees. We can promote those groups who aren't at work and at higher risk of poor well-being, such as the unemployed. There are ways that we can also promote social well-being, so improved interaction between people, such as volunteering, contributing to our local community. We can promote the well-being of older people through a number of interventions that sometimes get forgotten for this group. And so overall, these range of interventions are effective in promoting people's own health, so that they're empowered to really sort of work and live more efficiently. And this results in an impact across the local community. If we have good well-being, we've got about a 7-year increased life expectancy, according to analysis of British data.
If everyone feels good, then life's much nicer and life's much more enjoyable.
It's about wanting to be part of the community and actually caring about it. If you show respect, people respect you.
It is important to include everybody, because when people get left out, they sort of go into the shadows a bit and never get the full potential of life, which is to meet new people and have fun.
That whole thing about giving and compassion and warmth, I think that's at the core of well-being.
It's all about what you can do and what you can give to the community.
And I don't know anybody who is compassionate who also doesn't have a real sense of well-being, and I think that's really core to it.